Let's talk about immediate dentin sealing. Immediate dentin sealing, IDS, is a pivotal concept in adhesive dentistry, often implemented to enhance bond strength, reduce sensitivity, and improve the longevity of restorations. Let's break it down and review some of the literature on the topic.
Welcome to the Deep Dive. Today we're diving into immediate dentin sealing. IDS.
Yeah, IDS. It's certainly been a hot topic lately in dentistry and lots of buzz.
For sure. You sent over a ton of research on it, articles, literature reviews, the whole shebang. So before we get lost in all that,
Right.
can we just start with the basics? Like, what exactly is IDS and how's it different from the old school way of doing things?
Okay, sure. Imagine you're getting a filling or a crown, whatever. Traditionally, after prepping the tooth, the dentist would wait,
Wait for what?
Wait until the permanent crown or filling was ready. Then they'd apply the bonding agent to the dentin. That's delayed dentin sealing, DDS.
But DDS is like, we'll deal with that later.
Yeah, pretty much. But IDS is all about taking action right away. Boom. Instead of waiting, they apply the bonding agent immediately.
Really? Like right after they prep the tooth?
Yep. Even before they take an impression for the crown or filling.
Huh. Interesting. It almost sounds like they're trying to work with the tooth, like it's a living thing.
Yeah, that's a good way to put it. IDS is considered biomimetic, meaning it tries to mimic the natural processes of the tooth.
Biomimetic, huh? Sounds fancy. So how does sealing the dentin right away do that? Mimic nature, I mean.
Well, the enamel and the dentin in your teeth are bonded together, right? That bond is what makes the tooth strong.
Makes sense.
And IDS tries to sort of recreate that bond by creating something called a hybrid layer.
Hybrid layer. Sounds like something out of a sci-fi movie. What's that? Some kind of super glue.
You could say that. It acts like a bridge between the tooth and the filling, makes the whole thing stronger, more stable.
Wow, so it's more than just sealing it up. It's like reinforcing the tooth from the inside out.
Exactly. It's one of the big reasons why so many dentists are getting excited about IDs.
Right. And speaking of excitement, our listeners sent over a bunch of studies about IDS and all the cool stuff it can do.
Oh, yeah, there are definitely some promising benefits.
What's caught your eye?
Well, one of the most interesting things is how IDS can reduce sensitivity. That pain you sometimes get after a filling.
Ugh, yeah. We've all been there. Not fun.
No, not at all. And studies show that IDS can really help with that, both when you have the temporary crown and after the permanent one is in.
Oh, wow. That would be huge for a lot of people, especially those who, avoid the dentist because of sensitivity.
It's definitely a game changer. And it all comes down to the dentin tubules, those tiny little tubes in the dentin.
Okay.
When the dentin is exposed, the tubules are open. So stuff can get in and irritate the nerves, bacteria, air, temperature changes, you name it.
So that's what causes the sensitivity, those open tubules.
Exactly. And IDS seals them right up. It creates a barrier so those irritants can't get in.
Like a protective shield.
Yeah, like a shield. So less sensitivity. That's one big perk of IDS.
Okay, so that's one. What else? What else makes IDS stand out? Our listeners dying to know.
Well, some studies suggest it might even reduce the need for anesthesia during that final cementation appointment.
Wait, seriously? Fewer needles?
That's what the research is pointing to.
That alone would make a lot of people happy.
Absolutely. Patient comfort is super important, and nobody loves needles, right?
For sure. So, less sensitivity, potentially fewer needles. Anything else?
Yeah. There's also research suggesting that IDS could lead to stronger, longer-lasting restorations.
Wow, so it's not just about feeling better right away. It's also about having that restoration last longer.
Yeah.
That's great.
Especially for teeth that have had a lot of work done.
But I'm sure there's a but coming, right? Nothing's perfect.
You're right. There are always nuances, and some areas where the research is still, developing.
Okay, I like nuances. Let's hear them. What are some of the things we need to keep in mind about IDs?
Well, the type of adhesive or bonding agent that the dentist uses is really important. You can't just use any old adhesive.
So it's like picking the right tool for the job.
Exactly. There are different kinds of adhesives, each with their own, pros and cons. Some are filled, some are unfilled.
Unfilled.
Yeah, filled adhesives have these tiny particles in them. It adds strength and makes a thicker layer. Unfilled ones are thinner.
Huh. Okay. I guess the type of restoration probably matters too, right?
Of course, the size of the restoration, how much dentin is exposed, it all plays a role.
So the dentist really has to put some thought into choosing the right adhesive. It's not a one-size-fits-all thing.
Definitely not. And this is where more research is needed. We're still learning about how different adhesives perform in different situations.
Right. Speaking of specifics, our listener mentioned something about compatibility between adhesives and impression materials. Can you explain that?
Yeah, it's like you wouldn't mix oil and water, right? Some materials just don't work well together. You can't just use any combination.
So using the wrong combo could mess things up.
Absolutely. It could weaken the bond or even cause the restoration to fail.
Yikes. So dentists have to be really careful about which materials they use together.
Exactly. It's all about synergy. Finding materials that work together to create the best possible outcome.
Wow. I never realized how much goes into these procedures.
It's true. Dentistry is a fascinating blend of science and artistry, and techniques like IDS really highlight that.
Absolutely. Well, we've definitely uncovered a lot about what IDS is, but now I'm curious about the why. Why are dentists choosing to use IDS? What's driving this shift?
Ah, that's a great question. And it's one that deserves a deeper dive. There are a lot of factors that influence a dentist's decision to use IDS.
Okay, I'm ready to dive deeper. Let's shift gears and explore that decision-making process. What goes into a dentist's choice to use IDS or not?
Sounds like a plan.
Okay, so we're back and ready to dig into the why behind IDS. What makes a dentist say, yep, this is the right approach for this patient?
Well, one big thing is how much dentin is exposed when they prep the tooth. We talked about how IDS is really good at sealing and protecting the dentin.
Right.
So if it's just a tiny cavity, a little filling, IDS might not be as crucial. But for a bigger restoration, like a crown where there's more dentin exposed, then IDS becomes a lot more important. It's like, if you have a small paper cut, you probably don't need a bandage, but a deeper wound.
Definitely needs Band-Aid.
Exactly. So the size of the restoration is definitely a factor.
Okay, that makes sense. So size matters. What else?
The type of restoration, too, like a simple filling might not need the same level of protection as a full crown or a bridge.
Right, because a crown covers the whole tooth, so you'd want that bond to be super strong.
Exactly. Bigger restorations need a stronger foundation.
What about the patient, though? Like, if someone already has sensitive teeth, would that make IDS a no-brainer?
Absolutely. Patient comfort is key. So if someone has a history of sensitivity, especially after dental work, the dentist is more likely to suggest IDS.
Makes sense. No one wants to deal with weeks of pain after a filling.
No, definitely not. So yeah, size of the restoration, type of restoration, patient sensitivity.
Okay, got it.
Yeah.
Anything else?
Well, the dentist's own experience and what they prefer matters too. Some might be more comfortable with IDS for certain procedures, while others might stick with the traditional way.
Right, right. So it's not just science. There's an art to it as well.
Absolutely. Dentistry is both.
Okay, so let's say a dentist decides to go with IDS. How do they actually pick the right adhesive system?
That's where it gets really interesting. There are so many different bonding agents out there. It's not just grab whatever is on the shelf.
It sounds kind of like a puzzle.
Uh-huh.
Finding the right adhesive for the right situation for the right patient.
Yeah, exactly. It's a lot to consider.
So what goes into that decision? How do they choose?
Well, for one thing, they have to make sure the adhesive is compatible with the other materials they're using. Remember we talked about how some adhesives work better with certain impression materials?
Right, right. Everything has to play nice together.
Exactly. They also have to consider the viscosity of the adhesive, whether it's thick or thin, and how well it can get into those tiny dentin tubules.
So it's not just about sticking. It's about flow and seal.
Exactly. And then there's bond strength. Some adhesives have incredible bond strength, while others are, a little gentler.
Wow, so much to think about. I had no idea it was so complicated.
It can be. But experienced dentists know all the ins and outs. They take their time to choose the best option.
Speaking of experience, our listener mentioned something called the reverse spot bonding technique. Something about impression taking. What's that all about?
Oh, yeah, that's a neat technique. It's all about protecting the IDS layer while they're taking the impression. We want that bonding agent to cure properly, to create a strong seal.
Makes sense. We don't want the impression material messing that up.
Right. So they'll put a thin layer of glycerin or alcohol over the bonded dentin before taking the impression.
Huh. Interesting. So it's like a temporary shield.
You got it. That way, the bonding agent can cure without being disturbed. Makes for a stronger bond.
It's amazing how dentists are always innovating and refining things.
It really is.
Okay, so we've talked about how dentists decide if IDS is right for a patient and how they pick the right adhesive. But what about the long game? Does IDS actually make restorations last longer?
Great question. And luckily, we've got some great research on that. There was one study that followed patients with ceramic restorations placed with IDS for 11 years.
11 years. That's a long time.
I know, right? Really shows how durable these restorations can be.
So what happened? Did the IDS restorations hold up?
They did. They found a 96.4% survival rate for those restorations.
Wow, that's incredible.
It really is impressive. Shows that IDS can make a big difference in how long these restorations last.
So good news for anyone who wants their dental work to stand the test of time.
For sure. It's about investing in something that will last.
Okay, so lots of positives for IDS. But are there any downsides? Any risks or drawbacks we should know about?
Well, like any dental procedure, there are always potential risks. But overall, IDS is considered safe and effective, especially when it's done by an experienced dentist.
Right, so it's more about finding the right dentist than worrying about IDS itself being risky.
Exactly. And, it's not a magic bullet. It's not right for every situation. It's something that needs to be considered carefully based on the patient and the specifics of their case.
So personalized dentistry, tailoring the treatment to the individual.
Exactly. And that's what makes dentistry so interesting. It's a combination of science, art, and personalized care.
Well, we've learned so much in this deep dive. The what, the why, the how of IDS. It's fascinating. But I feel like there's still more to uncover.
You're right. There's one more piece of the puzzle we haven't talked about yet, and that's the temporary crown. That provisional phase while you're waiting for the permanent restoration.
Oh yeah, the temporary crown. It's easy to forget about that part, but I guess it's more important than we think.
It really is. The provisional phase is crucial to how well the restoration turns out, and IDS has a big impact on that.
Okay, you've got me hooked. Let's talk about those temporary crowns. What makes them so special in the world of IDS?
Let's do it.
Okay, so we're back and ready to talk all about temporary crowns. You know those things you have to wear while you're waiting for the permanent one?
Right. Those guys.
I gotta say, you made me really curious about this whole provisional phase, especially with IDS.
Yeah, it's actually pretty cool. Because with IDS, the temporary crown isn't just a placeholder. It's like a protector for the sealed dentin.
A protector.
Yeah, it shields that newly sealed dentin. Like when you're chewing and biting, it keeps all that force off the bonding agent.
Ah, so the bonding agent can just chill and harden up without any stress.
Exactly.
Yeah.
And that's really important for the long-term success of the restoration. If that bond is strong, it's less likely to break down over time. Less sensitivity, less chance of the restoration failing.
Makes total sense. So the temporary crown isn't just about looks. It's got a real job to do. Now, our listener mentioned something about temporary cements and how traditionally dentists have been kind of picky about them. Worried that some cements might interfere with the bonding process.
Yeah, that used to be a big concern, especially with cements that had eugenol in them.
But with IDS, it sounds like that might not be as big of a deal anymore.
You're right. Studies are showing that with IDS, the type of temporary cement they use, eugenol or not, might not actually affect the bond strength of the permanent restoration that much.
Wow, that's great news. Gives dentists a lot more options.
Exactly. It definitely simplifies things.
Okay, so that's one less thing to worry about. But what about, bacteria? Even with a temporary crown, aren't there still gaps where bacteria could get in and cause trouble?
That's true. There's always that risk.
Yeah.
But remember, IDS creates that seal right away. Right on the dentin. So it's like a barrier, especially during that vulnerable time when you have the temporary crown on.
Right, so it's not just about sensitivity. It's also about keeping those bad bacteria out.
Exactly. And this is where, that whole biomimetic thing comes in again. IDS is like working with the tooth's natural defenses, stopping bacteria from getting to the pulp and causing problems.
This has been so fascinating. We've covered a lot of ground today. Biomimetic approach, all the potential benefits, the materials, even those temporary crowns.
It's a lot to take in.
It is. So as we wrap things up, what are the key takeaways? What do you really want our listener to remember about IDS?
I think the main takeaway is that IDS is like a new way of thinking about restorative dentistry. It's not just about fixing a tooth. It's about restoring it, in a way that makes sense, in a way that works with nature.
I love that. A more natural, holistic approach.
Yeah.
And it sounds like the research is really backing that up. Stronger restorations, less sensitivity, happy patients, all that good stuff.
Absolutely. But, it's not a magic solution for every single case. The decision to use IDS, it's something that should always be discussed with the dentist. They're the experts.
So it all comes back to that personalized approach, finding what works best for each individual. But before we go, I have one last thought for our listener. We've talked a lot about the science of IDS today. But dentistry is also an art, right? Every tooth is different, every restoration. It's like a tiny sculpture. Makes you wonder, how does a dentist's skill and experience, that artistry, how does it all come together to make IDS really shine? What are those subtle touches that separate a good outcome from a truly amazing one?
That's a great question.
Maybe we'll have to save that for another deep dive. But until then, stay curious, keep those dental questions coming, and remember, your smile is worth exploring. Thanks for joining us on the Deep Dive.